At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Welcome back to another edition of HSA Today. I'm your host, Chuck Taylor. I want to thank you once again for tuning in to the show. Each and every Friday we get together, and also Saturday at 1, and we talk about healthcare and what HSA is doing, the wonderful things they're doing, and also make it very personal for you because we know that, health is a big part of your life, and it should be. I know a lot of times we overlook it due to busy lifestyles and other things, but you know what? That is your last front. So we want to make sure that you're in best working order. And today I have a specialist with me, Dr. Allan Larsen. He's over at the HSA Sports. Is this traumatologist?
It's sports traumatology.
Oh, okay. And orthopedic surgeon.
Yep.
And in preparing for this interview, because normally I know a little bit about stuff, but then I was like, wow, okay, I had to look up quite a bit of this to understand the realm of what you do. Why don't you let our listening public kind of have a round, broad view of some of the things it involves in your field?
Well, being a sports traumatologist is dealing with conservative and operative treatment of just about any sports injury.
Mm-hmm.
So that's what the sports traumatologists do. The orthopedic surgeon is the guy that you hope you don't see in A&E.
Exactly. Okay. Understandable. And sports medicine, sports industry now has become billions upon billions of dollars, and these athletes are the commodity. So the job is to keep them well, keep them safe, keep them healthy. Is that correct in saying that?
Well, it's not a bad description.
Mm-hmm.
In Denmark, where I was working before I came to Cayman, I was in one of the biggest sports clinics that we have in Denmark at the University Hospital. And there we had the national teams within just about any field. We had the people who went to the Olympic.
Mm-hmm.
So those national teams, it's the elite, and the elite, let me put it this way, since nobody listens to this,
mm-hmm.
they're horrible to work with.
I can imagine.
Because ordinary people who wants to stay fit and they want to be active, they're much easier to work with.
Mm-hmm.
Because
they understand it's being healthy and having a healthy lifestyle outside of being healthy for your job.
Exactly. And that in that case would be, let's say that would be 95% of the patients we saw.
Mm-hmm.
5% would be the absolute elite,
mm-hmm.
world champions within certain sports activity. And they're a bit more difficult to work with. But if you don't have the elite, you don't have the broad spectrum of people. So it's fun to work with both.
Uh-huh.
And the elite does exactly what you tell them, plus 100%.
It evens the playing field quite a bit.
Exactly.
Excellent. So one of the things that I was looking at, and it's so funny because just a few days ago I was watching, they were talking about the difference in athletes' abilities over the last 50 to 100 years. And I'm a TikToker, so every now and again you run across this, and they showed the length that somebody could jump in the 1900 Olympics versus the 1960 now to today, and it's triple, quadruple. So we're talking the body has changed to adapt to these and we say extreme sports, but overall the body has changed itself over the course of years because now we do a lot more sitting up. We're computerized, so we're not exercising as much as we do for the normal person. Tell me some of the injuries that you see as sports injuries, just on a regular timing.
I'm a specialist in knees. So I do a lot of knee surgery, foot ankle surgery. So what we see there is, for instance, ACL reconstructions. Some of them, you can treat them conservatively. About 40% of patients having an ACL tear, they'll be treated conservatively and have a good result. They get stability because we increase the muscle strength around the knee. 60% will have to have surgery.
Okay.
In the older days, for instance, let's say you were 25 years old, that would be sort of that age that you would have an ACL reconstruction.
Okay.
And say, being older than that, you'll never ever see a surgeon. We didn't want to operate them. I've operated the oldest person in Denmark and Norway where I came. They're 65. They didn't have any arthritis. Doing skiing every day.
Wow.
There's not a lot of people on Cayman who skis, but mostly it's handball players, football players, and skiers. That's the main categories of those who've got ACL tears. And why shouldn't you have a great life, good quality of life, and a stable knee?
And pain-free.
Pain-free.
Wow. 65. So surgery, the average age of surgeries has moved up quite a bit.
It has moved up quite a bit because people are more active. And that means that in the older days, well, you were active when you were young, you were playing football, doing any kind of sports. And then when you had a few kids, got married, you would sit home and it might be the remote who was the most active.
Right, exactly. You become the couch potato, kind of rolled over, hit a few buttons.
But now, for instance, if you're up at 5 o'clock and I see tons of people out there out running, they're out walking, everybody's active.
Right.
So that means that elderly people, they're just active.
Yeah.
And that means you get minor injuries and some of them get overuse injuries.
Okay.
Everything can be treated.
Understandable. So this is just a quick let you know, for athletes in Cayman seeking recovery or performance improvement can look forward to some exclusive care and even advanced treatment, I would say. And this is for the opening of the new Sports and Exercise Medicine Clinic. Now, I'm telling y'all the date, and the date is on Friday, August 26th, which is at the second floor of the Smith Road Medical Center. Now, that's where the new building that they've renovated for HSA right there on Smith Road. You can't miss it. It's a second-story building right before the little mini roundabout there when you're going towards the HSA. So this is a big step. This allows our athletes here to actually have a dedicated area just for sports recovery and improvement. So tell me a little bit about that.
Well, what's going to be in there is there's going to be sports medicine physicians, there's going to be nutritionists, there's going to be physiotherapists. I'll be the sports traumatologist in there. So there's going to be a huge field of people who just are dedicated to doing sports exercise, medicine, and sports traumatology.
So
Great.
it'll be a good cross section of everything. So literally you can have say from your neck to your ankle looked at in various capacities. We got a lot of squash players on Island. We got rugby players. Cayman over the last I won't say the last few years, but over the last years have become a very active society.
Exactly.
It's we have a lot. Running has always been one of the things here because we have such a beautiful, safe island. But then now it's incorporating more and more areas of sports. Soccer's always been big, but now you go into swimming, you go into all these other volleyball and all these other sports, and this is open for any athlete.
Absolutely. There's no restrictions. Anyone who has obvious injuries, any kind of sports injuries, or just want to sort of have information, help to improve the sports medicine people, the pain management people. So there's a lot of people who would like to help people improve their sport.
Yeah, and the good thing I like about it, it's all under one roof.
Yeah.
It makes it simple because when you're having some sort of sports-related injury, the worst thing you want to do is you go to one doctor, and then they send you to another doctor who's another 10-minute drive away, and then they'll make a referral for another one for next week, and then you'll see a pain management. So the process can be arbitrary. It could be it takes a while. And this is all under one roof that the HSA has compiled all these professionals under one clinical roof and made it easy. So one of the things is we want to let the sports community know that, even though we have our weekend warriors also who are not in organized sports, this is also open for them. It doesn't matter. It could be the national team. It could be anybody who has a related industry or concern, because it says that it's about advanced treatment also. So you're looking to maybe better yourself. You're having a little twinge and you're trying to get rid of it. This is a good way to go talk to professionals and move forward in the right direction.
Definitely.
So you were telling me a little bit about your background. What made you decide to get into sports medicine?
Well, I exercise daily, so I like to be active myself. I used to be head of our research and cartilage transplantation team at the university as well. So I did about 2 out of 3 cartilage transplantations. And most of those are sports injuries. Worldwide, if we compare Denmark to the US, we see 3,000 ACL injuries a year in Denmark. We see 200,000 in the States. And normally in Denmark, for instance, we would see 3,000 cartilage defects or cartilage damage to patients. Only a few of those need surgery. I've been doing research within cartilage transplantation in about the last 10 years, 10, 15 years. And that's one of those areas where I bring a bit of expertise.
Okay, excellent. You were telling me that you specialize in the knee.
Yeah.
Give me some ideas of treatments. I mean, of course, you have to, for my listeners, there's different level of athletes, so that means that there's automatically different levels of treatment and things to do. But give me a broad scope of that.
What we do in these, it could be, for instance, cartilage transplantation. It could be stem cell activation. If you have a cartilage defect, it could be reconstruction of your cruciate ligaments, your side ligaments. It could be meniscus repair. That's sort of those issues. There can be impinged, irritated tissues. There's tons of issues in that knee. It seems simple, but
it's a lot there. On average, if you were to do for ACL, what's the actual title of it? For the knee there?
And anterocruciate ligament.
That.
Yeah.
Generally, how long is surgery and recovery time on just an average person who's healthy, not an elite athlete, but just a normal Jane or Joe?
The normal rehabilitation time is 12 months. It doesn't matter. I say the same to everybody. If you're Ronaldo or Messi, you can be whoever you want to be. It takes you 12 months to recover from an ACL reconstruction. We had a few years ago, it's 15 years ago, we had some of those fixation devices who said that actually down to 4 or 5 months, after that you can start competitive sport. All of them ruptured. It wasn't that good idea. I've been doing a lot of research within ACL reconstructions as well. My PhD and some of those PhD students I've had at the university have done their PhD within my ACL reconstructions. And if we compare that to the average, it is 9 to 12 months. You can't force it. Some of those national athletes I've had, a few of those, if you start too early, well, you will rupture it. It needs time to heal. So the rehabilitation time between 9 to 12 months. You can't force it.
Right. It's something that there's no amount of fixing it. It just needs time.
It just needs time. It's 2 tunnels, and whatever we put in there, either from the kneecap and the ligament underneath it, or we do some tendon hamstrings at the back of your thigh. If you use those, it just takes time for that bone to fixate it properly.
Understandable. And we keep hearing, like, I shouldn't say that but I know that football injuries are overstretching, overpowering. In seeing that, how can they better serve themselves to make sure that these accidents these occurrences don't happen?
Let me put it this way: I never brag, but I am Danish, so we'll have to mention the Nordic hamstrings.
Okay.
Any football player is sort of being punished with that exercise. It's a simple exercise. You're down on your knees and you bend forward, simply to strengthen your hamstrings. And if we look at a few years ago, when no professional football players, I've been taking care of a lot of professional football players, and all of them got hamstrings.
You can drop a name or two if you.
Well, they're Danish, so they're probably nobody would know them.
Okay,
except
right.
Danes. But it's just tons of these football players, they get hamstring injuries. The biceps femoris is a muscle at the back of your thigh. That's the most common hamstring injury you get. Mm-hmm. And if you do Nordic hamstrings, which is just one exercise, it's so easy to learn. If you do that at the beginning with those football players, they did 1 minute a week, then now they have to do it every time they exercise.
Right.
They just do one of those exercises, and it simply prevents 74% of those injuries to hamstrings.
So 1 minute exercise, the Nordic hamstring, which is basically up and down, moving forward.
You're moving forward with your upper body and on your
returning.
Knees. Yeah.
Right. That can improve up to 74%.
Yeah.
Reducing it. Wow.
So it's simple to prevent those overuse injuries, because any football player, when they kick, that's the muscle they pull their lower leg back with. So if you make that stronger, it just prevents you from having those injuries.
And I'm sure I got a lot of UEFA League listeners on the station here in the Premier League. When you see them grab the back of their ankle and keel over, that's the muscle.
That's the we'll see them again in 2 months.
Yeah, exactly. That's when you see them pulling up that, you think, oh, it's a hamstring injury. No, it's a little bit more up than that. And that's incredible. But if we have the knowledge of that, why haven't they been pushing this?
Because it's so boring. It's boring to do preventive medicine, but it's just and that's why it comes from the professional clubs in the beginning. Because having, as you mentioned in your introduction, there's so much money involved in professional football clubs. Mm-hmm. So taking one of those players out, well, it's going to cost them a fortune, and they're insured. So normally the professional football players, they will start to do this preventive. And then it sort of rains down through the amateur clubs,
right?
Where it should belong in any kind of club.
Yeah, it should start from the amateur building up, because as you said, if you have this injury, it can happen again.
It most often will, because if you see a muscle which heals, it will heal with scar tissue, and scar tissue is stiff, which means that you have an even higher risk of getting the new muscle injury, because you got stiff tissue to mobile tissue being your muscle, which can move, but then you got the scar tissue in between the muscle rupture and the two muscle parts, and that's stiff.
Right.
It simply makes it even tighter.
Right.
So if you don't start doing something there,
it makes it easier to rip again.
Exactly.
And see, that's the thing that I think that I would want my listeners to know, is that the first step is prevention. You know that if I'm 65 and I've never had a rupture before, that's good. And at 65, if I get it, then you can work with it, and that's the first area of scar tissue. But if I'm 25 and I got 20 years of ruptured tissue, that makes it impossible. Makes it entirely impossible. So once again, folks, if you're just tuning in, you're listening to HSA Today. I'm your host, Chuck Taylor, and I have with me specialist from HSA, Dr. Allan Larsen. He's a sports traumatologist and also orthopedic surgeon over there at the HSA. And they're doing something very progressive, something brand new. They're opening over in their new building there, which is the second floor on the Smith Road Medical Center, a sports and exercise medicine clinic. And just to make it short, it's called SEM. It's opening on Friday, the 26th of August. And this is a great opportunity for people who, have that active lifestyle. I don't want to say just athletes alone, because it could be anybody. Correct in saying that?
Anybody having an overuse injury. So you don't have to be an athlete. If you got an overuse injury, well, still with repetitive work, you could have the use of either prevention or treatment. It could be a tennis elbow, golf elbow, any kind of irritation to a tendon.
Right, exactly. And they're opening this, and it is for the public. It's opportunities for extensive care and advanced treatment. As I said, it's opening on Friday the 26th. And you know what? This is an opportunity for Cayman striving sports community and to find out and also educate themselves about moving forward in the right direction. We're going to take a break, and we'll be right back. You're listening to Healthcare Today with the HSA.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Do you want to be a star? Cayman's #1 community station, Bobo 89.1 FM, can help. Bobo 89.1 FM is your voice. If you want a platform to create your own radio show, Bobo is the station for you. We provide the time, support, coaching, and the radio station to make yourself heard. Is it a talk show, music show, self-help, a show for kids, faith, advice, politics, or news? It's your show. It's your voice. Get in contact with Chuck Taylor at ctaylor@dmsbroadcasting.ky or call 745-3375 to schedule an appointment today. And let your voice be heard on Bobo 89.1 FM, Cayman's community station.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
And we're back. You're listening to Healthcare Today with HSA. I'm your host, Chuck Taylor. And with me, I have Dr. Allan Larsen. He's the HSA sports traumatologist and orthopedic surgeon. And we're talking about the new clinic that they're opening up over at the Smith Road Medical Center and just some of the things that it all encompasses, because it's a full team of people over there who are dedicating to bringing the big, and I say big business, but really it's homegrown business when it comes down to sports exercise medicine. We're concerned about the big athletes, but then it's also for the normal person who may have a rotator cuff tear. Isn't that correct?
Definitely, yeah.
And things of that nature. So it works from tendonitis, come right down. Tell me a little bit about the range of fractures, because sometimes you hear somebody will be doing something and they'll have a hairline fracture and it'll do some bone. Tell me a little bit about that.
Fracture-wise, people normally go to A&E because they've had a severe trauma, so we want an X-ray. So there'll be patients going to A&E. But you're going to have stress fractures. For instance, overuse injuries, one of those fractures who really takes you out for a long time is stress fractures. Mm-hmm. Mostly in the foot. You can have it in other areas, but it's mostly known in the foot. So that's one of those fractures we would be seeing in that clinic. But acute fractures, normally they would be going to A&E to have their X-ray done.
To get X-ray done right away, right.
If they need to be admitted, well, they'll be admitted and I'll operate them on the admission. If it's minor fractures, well, they'll be treated as an outpatient and going home the same day.
Okay.
But they'll be the patient in A&E.
Right. And the thing about it is a clinic like this very much is a much needed niche clinic, because, sometimes people have a problem that's been developing over a course of time.
Yeah.
Those are the ones that kind of scare me, because we learn to live with pain, and so it doesn't bother us as much, especially when it comes, I ran 10 miles and I'm feeling winded, but there may be something more to that if you have the pain in your leg or your knees and joints and things of that nature. So once again, the clinic is open on a Monday through Thursday, 8 a.m. till 12 p.m. To book an appointment, give them a call at 244-7774 or 244-8005. No referrals is necessary. And they're Dr. Larsen is just ready to get you back in shape and improve your game. Thank you so much for stopping by today, sir.
Thank you. Thank you for inviting me.
Excellent. We'll be right back. This is HSA Today with your host, Chuck Taylor, and we're talking about sports and exercise medicine and the new clinic that the HSA is opening up.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.